again, Zikri Khalil. Welcome again to another show of It Matters. I am so stoked to be back here after waiting for another week to have the show started. Now, this week is, again, we're doing something special for the entire month. And I'd like to give some insights before we dwell into our two amazing guests for tonight. I just want to say that in the battle against cancer, every moment counts. And this whole month is all about Cancer Awareness Month. And every action makes all the difference. So it's a fight that touches everyone and sparing no one from its reach. Just to give you a bit of statistics, it's quite stark. Between 2012 to 2018, there's been a staggering number of 90,000 lives that were lost to cancer in Malaysia alone. Yet behind each statistics lies a deeply personal story of pain, hope, and resilience. It's a battle we can't afford to lose. And that is why for Cancer Awareness Month, Incitement has been in an honorable place, have been trying their best to bring one of its kind campaign together with the 4 leading cancer charities in Malaysia. So for this episode, we're going to sit down with the President of National Cancer Society Malaysia, Dato Dr. Saunthari Somasundaram. I hope I pronounced that correctly. Please forgive me if I did not, Dr. Sound. And also nutritional pharmacist and key opinion leader, Shirley Tiong. And welcome to the show, ladies and ladies.
Hey, hello everyone.
Your
Thanks.
name is quite of a mouthful, but I'm honored that I'm able to pronounce it the best I could. So sorry, Dato.
No, it's fine. Pretty good. Everyone's always had problems with my names ever since I was born, I think. It's a little bit
I can address you as Dr. Sound. Am I right?
Yes, that's fine. No, Sound by itself is fine.
Okay, great. And Shirley, it's so nice to have you on the show. Like I said right before in backstage, I managed to learn a bit about you. You know, you're a person with many hats. You have your own product. You have your own blood test product. You're doing coaching. You're doing a lot of many things. And it's an honor to have you in the show. And I look forward to your involvement and also your questions. I'm sure you'll ask a few questions to Dr. Sound. And I'd like to begin with the very basic question, Dr. Sound. I hope you don't mind. If you could provide like an overview of the National Cancer Society Malaysia's mission and objectives, mainly particularly in terms of cancer prevention and early detection.
Okay. So the National Cancer Society of Malaysia is a charitable organization. It was formed in 1965. So really, really, really long time ago. It was formed at the time by a group of doctors who were interested in cancer and wanted to expand the work in Malaysia. So since 1965, we've grown incredibly from just a really, really small organization to one which looks at different aspects of cancer. So we have 3 pillars, one which is education, the second is care, and the third is support. So with education, it's what it says, we go out there and we educate as many people as possible. So we do it through schools, universities, the general public, communities, corporations, and we also do medical education. So we actually go into clinicians to talk to doctors and nurses and allied health staff to really increase the awareness of cancer, just not in the clinical sense, but how it impacts society, how it impacts the community, and how it impacts the individual. So you actually, for us, it is putting a face, identity to every single person who gets cancer. So that people just don't look at it that, you're a breast cancer patient or you're a, colorectal cancer patient, but, you are Mary who has breast cancer. It's truly important to us that everyone is seen as individual. The second part of what we do is our care module of our care pillar of the National Cancer Society of Malaysia. And that is where we go out into communities. And we go out into communities to do cancer awareness, promotion, screening. So we do checkups on people. And we basically try to empower people to take control of their health. But instead of, them coming to clinics or coming to hospitals to do it, we want to bring it out to them in a space where they feel safe, in a space in which they're familiar with. So that's our care component. And then we have our psychosocial support, our support aspect of it, which is really all about people who have been impacted by cancer. So whether they're actually people who have cancer, their caregivers, their family members, we have a whole system in place to basically follow you throughout your journey and give you the support that you need, whether it be emotional, whether it be, counseling, needing financial help, social services, whether you need to talk to a doctor, just to have an idea of what's going on with you. So we have accommodation for people who have cancer and need to go into hospital daily in the public sector, so they can stay with us and we will drive them into hospital, etc. So I would say, I think, we have the most comprehensive cancer support services in the country.
I was told by the other members of the other non-profits that told me, like, you have probably one of the best facilities for that as well.
And that's lovely to hear from all the others as well. We are family. I think in terms of all the non-profits in cancer, we all try to collaborate with each other and work with each other. Because at the end of the day, what we want is the best possible care and support for those impacted by cancer.
Yeah, exactly. I mean, from that testimony from them, it's let's love. That's what they say. And I like to ask the question to Shirley. After hearing what you just, have you heard of NCSM before coming to the show, or?
No, I have never heard of it, but I'm really, really happy to know about that, because I think I have a lot to share. I can share about this society to many people who really needs it. Yeah. But how do we assess? How do people actually access to this service?
So for us, there's multiple ways to access this actually, but we actually have a hotline number. So for our, when we talk about our psychosocial help that we do, we have a helpline. So that's our hotline number, which is, I hope I get it right, because I'm awful with numbers. It's 1-800-88-1000. Yeah. So if I get it wrong, I apologize to everyone.
I was going to type it in, but I always forgot.
But yeah, we've got the website and the Instagram and the Facebook and stuff like that as well. But what's wonderful about the hotline is that if you have any questions about cancer, there's someone on the other side who can try to answer your questions. And if they can't answer your questions, they can put you in touch with someone else in the team who can answer your questions. And the staff who look after the lines are multilingual. So that's another aspect, I think, which is important when it comes to cancer and other diseases, is that you're able to talk about it in a language that you feel comfortable with.
Correct.
Because, exchanging of information, communication is just so important, that the right messaging goes through and you get the right information that you require, and you're not frustrated about trying to acquire that information. So for us, we are here to take out that frustration for you as much as possible and to help you step by step.
And I was going to ask also to Shirley, since it's the first time learning about NCSM, could you share with us about the work that you do that you're so passionate about? And is there any relations to perhaps dealing with a potential customer or a family member or a friend who may come across of having some symptoms of this deadly disease, and what's your experience when that happened? Because I know I'm trying to relate a lot on what you do, because you're a nutritional pharmacist, right? So Is there any direct correlation with that as well?
Yes, so basically my profession is pharmacist, and I mainly practice nutrition and functional medicine. So that means, like things like cancer, not just limited to breast cancer, but any cancer happens not just, in one day. It's basically, it's something that happen and accumulate, year on year, and then that's how it grow into a cancer. So that's how it grows into a disease. So and I also help a lot of women with hormonal imbalances like PCOS, endometriosis. So all these people, they are women. So women have a very has a higher risk to get breast cancer as compared to men. And also when a woman hit, 50 years old, the risk of breast cancer increases. So I work a lot with women. Yes, I do have many clients who comes to me for a nutrition plan. How do they prevent cancer? Let's say if they have a first degree family who has breast cancer before, and they have all these hormonal issues as well, so they are worried. So they will come to me to look for some prevention in terms of dietary ways to help them, a more holistic approach to help them to prevent the cancer risk. And also I do have patients coming to me to ask me to help them to come up with to monitor them, to come up with a program to help them, to monitor their diet during the course of the chemotherapy treatment, to help them to manage the side effects, as well as to teach them how to eat so that they can boost their immunity, and also to help them to generally just feel better when they are on this journey. Yeah, so that's basically my scope of work.
And would you say part of your one of the biggest purpose is prevention other than before cure?
Yes, I do prevention. I do have clients who comes to me when they have breast cancer and when they're on the treatment because they feel very fatigued, emotionally. They need help. But of course, I'm not the expert in mental health, but I can refer them to people who can help them, and maybe some advice on the exercise that they can do. But mainly it would be based on like what type of food that they can eat to help them to reduce the inflammation, to help them with, the nauseous and vomiting, to help them to pick up the immunity and things like that. And also maybe to suggest some supplements as well that can help them to manage the side effects of chemo.
Okay, understood. I'm just going to go back on that topic of prevention, and I want to ask to Dr. Sound on this matter. Since early detection is often cited as a critical factor in cancer treatment outcomes, right? I just want to ask you, Dr. Sound, from your experience with NCSM, are you able to elaborate on the importance of early detection, and how does National Cancer Society Malaysia work to promote it? Because from what I learned from the past 2 weeks, talking to Pink Ribbon, talking to Breast Cancer Wellness Association Foundation, they told me that the number one cause of death of cancer in Malaysia is breast cancer, but on a wider scope, the number 60% of patients who do get treatment or go to a doctor for the first time to kind of diagnose themselves whether they have cancer or not, 60% of them are already at a terminal ill phase, or at a phase 4, which is pretty high. I would like to pose this question to you, and perhaps you could enlighten us on how could we do so better.
Okay. I'm going to roll it back a little bit because you've just asked me questions on early detection, and previously you were talking about prevention. So if you don't mind, I'll just go through a little bit about in terms of the definitions that we use.
Yes.
So in the early phases, we have 3 phases basically, which is the preventive phase, the screening phase, and the early detection phase. So the prevention phase is basically what Shirley was talking about a little bit as well earlier on, is looking at the nutrition, looking at the types of food that you eat, etc., which could decrease your risk for cancer. Specifically for breast cancer, since we're in the breast cancer month, unfortunately, breast cancer is one of the cancers which only about 10% can be stopped, can be prevented. Because the biggest cause for breast cancer is, well, two biggest causes. Number one is being female. Just by being female hormones, that's your biggest risk of getting breast cancer. Number two is age. As Shirley mentioned, as you grow older, your risk increases. There are other cancers in which your diet, your nutrition, things like that make an impact. So when you're talking, say, the simplest thing, lung cancer. If you don't smoke, your risk of getting lung cancer is very low compared to someone who smokes. So if you stop tobacco, your risk for lung cancer decreases. So that is an example of a preventable cancer. The other preventable cancer when we're talking about women, of course, is something like cervical cancer of the cervix, where it's caused by a virus. So we can stop you from getting that virus. We can actually prevent the cancer. So that comes in with your HPV vaccinations. So you've heard of, us trying to promote younger girls, the age of 11 to 14, getting their HPV vaccination done. And that's to ensure that later on in life, you're protected against infection with the HPV, and then, leading on to cervical cancer. So that is preventive space. And the preventive space in cancer, actually, when you talk about global figures, we think about 2/3 of all cancers can actually be prevented. And 2/3 of all cancers being prevented is enormous if you think about it. The top cancers that we have, lung cancer, cervical cancer, colorectal cancer, all these cancers actually can be prevented by following or modifying your food intake, your nutrition, etc. And the amazing thing about it, and the good news about it, nobody talks about good news with cancer, but the good news about it is that if you modify all these things, and Shirley can talk about it a lot, I think, you actually decrease your risk, not just for cancer, but you decrease your risk for heart disease, you decrease your risk for diabetes, you decrease your risk for hypertension. So it's not in silos. When you look after your body, when you look after your health, you're not looking after it in terms of only one disease. You're actually looking after it in terms of a whole multitude of disease. And that's why nutrition and physical activity is something that we promote so much. But that's really in the preventive space. The screening space that we talk about is actually taking control of your health by doing examinations or doing tests when you're well to find out if there is something wrong that you don't know about.
Yes.
Okay? And so that's so that you can find things early. So the screening for screening phases, it is like for breast cancer, I'll come back to breast cancer again since we're in the month, is doing your breast examinations. Every girl over the age of 18 getting to know their breasts, getting to be aware of their breasts, how their breast feels at any time of the month, because your breast changes. With the hormonal levels in your body, your breast changes. And before your menses, your breasts become a bit lumpy, a bit swollen. After your menses, it becomes softer. So recognizing those changes so that if there is something abnormal, if you suddenly feel something which is hard or, thickened or a little bit irregular that you've never felt in your breast, you know that that is not supposed to be there. So having that awareness of your breast is incredibly important. But other screening things for women who are older, doing your ultrasounds, doing your mammograms, etc., are important. For cervical cancer, doing your pap smears are important. For men, checking for colorectal cancer, is important because it's the number one cancer and it's also a very preventable cancer. So that is really screening. Early detection, I know this has taken a long time for me to get to early detection, which is what you asked me, Zikri.
Yeah.
Early detection is really when there's already something wrong with you.
Okay.
and it's visible, or it's, it's symptomatic, meaning that there's signs that there's something wrong with you. So it's recognizing that there is something wrong with you. So it could be recognizing that, yes, there is a lump in your body. For women, yes, breast cancer is the most common cancer. And it's one of the cancers which actually, though you can't prevent it, can be found very early.
Okay.
And again, as I said, your hand is the most important investigative tool in that sense, by doing your breast examinations. So early detection for certain cancers, as you said, is truly life-saving. And in Malaysia, yes, 42% of breast cancers are found in later stages, in stage 3, stage 4. But what I would like to say is that though that is devastating, and though it is alarming, because it shouldn't be at such late stages, we should be finding cancers at a much earlier stage. I think what is really, really important to note is that there have been so many advances in treatment of cancers now that even if you're found at late stages, there's something we can do about it.
Okay.
It might not be curative, meaning that we get rid of the cancer completely, but it could be a point that you can actually get treated and live with the cancer. And for many women in that position, they die of something else other than breast cancer because we have the breast cancer under control.
I see.
Yeah.
Okay. I'm just gonna kind of trying to put if you don't mind, Shirley, I'm just gonna ask you a very personal question from your side. Do you know someone that have gone through this kind of procession where they found out that they have cancer of some sort, and for that experience for you, was there a point where you really did your best to help with what you're doing as a nutritional pharmacist? And if you can walk through it a bit, if you don't mind, of course, that would be great. And perhaps maybe from there, I'm going to ask back to Dr. Saung on what could have been done, or what possibilities could we do for the future.
So very unfortunately, this year I have 2 friends, very dear friends, who are diagnosed with breast cancer. And one is diagnosed when she's diagnosed. So what Dr. Saung mentioned, 42% of Malaysian women is diagnosed at stage 3 and 4. And she is one of them. When she found out, she is diagnosed at stage 3. And to her, she has never had, I would say she is shocked when she's diagnosed at stage 3 because she has never actually noticed any notable change to her breast. She thought the lumpy part could just be normal to her, and she had fibroid before, and that's why she always, had she thought maybe lumpy breast is like, it's just part of the fibroid symptom.
Yeah.
And so when she had her fibroid removed, she started to feel more about the breast because the lump is always there. So when she went to a massage, went for a whole body massage, the person told her that, there's something not so normal about your breast because the lump seems to be growing. It's getting bigger, and that alarmed her to go for the checkup. So when she was diagnosed at stage 3. And the other friend, she is a recurrent stage 4 breast cancer. Of course, the 2 experiences are quite different because one friend, she bought medical insurance, and the other friend, she didn't have enough medical coverage. So they went through very different treatment path. So I just see a 2 different journey from a person with medical insurance and without. One has to go through government hospital it's a lot of waiting games, even to get one screening done, it's taking ages, and I think it takes about months for her to find out that her cancer is actually recurrent, and where is the cancer, as in it has already gone into her bone and her brain. I think that took about 3 to 6 months at least for her to find out that. But the other friend, she has access to private hospital, and so she's very fast. Everything is diagnosed in maybe less than two weeks, and then she had her treatment done immediately. So that's my experience with people who has access to private treatment, and people who doesn't have access to private treatment.
Okay, and as how did it affect you as a friend?
I think so breast cancer is a very, very common disease among women. I think 1 in 10 women will get breast cancer in their life. So I think that is so common for women. So it's very, very important for us to, like what Dr. Saun mentioned, it's very important for you to have the awareness of your own breast, any changes to that. Do regular non-invasive screening, as in you have to examine your breast in front of the mirror to notice any changes. I think that's very important. So when you are so even if you get it, it can be detected early. So it's not like stage 3 and 4 where you have to go through a more aggressive treatment and mastectomy has to be done. So it's a more painful journey for people who are diagnosed with a more aggressive cancer.
Absolutely. I was going to ask back to Dr. Saun after what Shirley shared. For NCSM alone, what initiatives do you have, for the public that most of us probably wouldn't know, and that could benefit on preventing themselves, based on the cases of Shirley's 2 friends, because a lot of people don't know that a lot of the other cancer nonprofits I discussed with, they give a lot of free screening everywhere, but there's not many take-up rate, or for the matter of fact, it's not even taught in school. So kids are not really aware of their anatomy of their body, on what they should do when it comes to these things.
I think, just again, going back to what Shirley said about her friends, I'm really sorry that your friend had that journey that she had, going through the public health sector alone. Why I say that is that, as I mentioned before, we have the hotline, we have the helpline, which is 1-800-88-1000. If she had called our helpline, just to take you through what would have happened, is that if she had called our helpline and mentioned that, say she felt that she had another lump, or she was having symptoms, we would have been able to do a mammogram for her free of charge at our center. We would have then been able to sit her down and talk to her in terms of what other tests might be likely that she needs to get done, and depending on what she could afford, etc. We have collaborations with private hospitals to do investigations. So whether it be CT scans or PET scans, other scans that we don't provide ourselves, that they will do it at a very, very much reduced cost than what they usually charge. And we would be able to get those investigations done for her. And then with all those investigations all done, we could have referred her directly to a public hospital. So we would have connected her directly to the public hospital. So that would have cut down her waiting time to get into the public hospital. So that, that would be, something which is substantial in terms of cutting that 3 months to 6 months that she had waiting to 1 to 2 months at most. And at the same time, at our center itself, we also have the social workers. We have counselors, we have psychologists, we have dietitians, and they all would have come together to help her, holistically, to look at how they could help her with her symptoms, et cetera, and to support her throughout her journey. And that's the most practical thing I can say in terms of anybody who feels that they have cancer or who are alone in their journey. Call us up, because, honestly, we are there. We are there to help, and we are very happy to be able to do as much as we can to help people through their journey, to shorten that journey, or, to make that journey a little bit more comfortable and reassuring. So that's the practical aspect of what we do in terms of psychosocial support. In terms of Zikri, you mentioned in terms of screening and early diagnosis. It is really, really difficult to break the myths around breast cancer, especially, or any cancer. A lot of people think that I don't have cancer in my family, I'm not at risk of cancer. And that is the biggest myth or misconception out there when it comes to cancer, because anyone can get cancer. But because of that misconception, a lot of people don't feel that they need to know about cancer. They'll see a screening in a shopping mall. You'll see a booth, National Cancer Society booth or BCWA booth or, CanCa, there are all these different Makna booth, cancer organizations go out and do all these booths and stuff like that to do cancer screening. And people take a wide berth of these booths because they think, it's not going to impact me. It's got nothing to do with me. And that really decreases health promotion and health literacy in the country. So what we have done, I think COVID taught us a lot of things. Before COVID, we used to do all these huge, big campaigns, multimedia campaigns of going out there and doing big campaigns in shopping malls, et cetera, to try to increase health literacy and to increase awareness about cancer to people. And after COVID, though, we thought that, no, this really, really doesn't work.
Okay.
We can't, people aren't coming to us.
Correct.
We actually have to go out to them. And so we shifted the way we did things. And now, post-COVID, we actually have 3 big-sized trucks and a van that goes out across Malaysia. And we go everywhere and anywhere. Be it kampungs, to community halls, to various places, to actually do the screening, to actually do the health promotion, to actually do, the early detection, et cetera. So we have whole teams of doctors and nurses and allied health staff and volunteers. I mean, the wonderful thing about these trucks is that it's everyone can help out. So it's just not staff of NCSM who come on board, but there are volunteer doctors and nurses, they're volunteer students, people who are retired, anybody who has got time, who are willing to sit there to put data into the computer, to fill out forms, et cetera. It's a whole community spirit and a community force that goes out to help the community. And we actually go out into those spaces so that you don't have to travel far. So that you can actually do your health screening. And we even have little pop-up areas for children childcare, so that when the parents are coming for their tests, etc., there's someone looking after the kids, so they can't use that as an excuse not to do the investigations, because we all make excuses. There's always an excuse for us not to do an investigation or not to check up on ourselves. So we've shifted in that sense. We've shifted to look at the needs of what the people are having and trying to address those needs in the manner that they want it addressed. And then you also mentioned free screenings. So yes, primarily most of our screenings. One of the biggest screening campaigns that we have is the NCSM Etika breast screening program, which we've run for 5 years now. And Etika very kindly, is financing it for us. And it's a screening program where we go out into the community and we do health promotion. And with the health promotion, we identify high-risk women who need further screening. And then we send them to the nearest hospital to them. So be it private or to our center here in Kuala Lumpur, to get their mammograms or ultrasounds done. And with this, every year we reach out to, I think, nearly 30,000 women, of which we do about 11 to 15,000 free mammograms. So all this is free of charge. It is. It is the biggest screening program in the country. And, I'm really proud to say it's done by an NGO, but it's not done alone by an NGO, and that's what I'd really like to emphasize is that it takes a community to make a change. Absolutely. And we're all part of that community, whether it be the private health, sector or, industry, organizations, schools, universities, yourself, for having this podcast. It makes a difference because people hear, people listen, people feel that, yes, they've got a role to play. And whoever is listening out there, I will tell you, every single person has a role to play. Whatever you do in life, you have a role to play in changing someone's life from a disease point of view.
I mean, speaking of community, we have a community of people watching you live, and already we have 3 questions lining up. And I'd like to, if you don't mind, I'm going to ask one of the first questions. There's a person here by the name of Chris. He's asking to you, Shirley, do you recommend any natural supplements and vitamins to reduce the risk of developing cancer? Any specific that have shown potential in clinical or research settings? I'm not sure what he's asking to you, but the both of you, if you would like to answer this question, no problem. Shirley.
Yeah. So in my practice, I do practice personalized supplementation, and also, so basically for breast cancer prevention, we usually, it's not like what or any type of specific supplements that can target or that can prevent breast cancer, but it's more towards targeting well-being or general wellness, because the underlying inflammation, the underlying hormonal imbalances, the obesity, overweight, all these issues are going to be, is the risk factor for getting breast cancer. So it really depends on a person condition, which we usually study their blood tests to see what are the things that needs to be corrected, what are the underlying imbalances that needs to be addressed, and then we prescribe accordingly to that.
Okay, and there's a follow-up question to that by Esther Lai. She's asking, what is the best kind of food recommended for those who have cancer? What supplements can help to boost and elevate pain at that time?
To elevate pain from chemotherapy? You mean to manage the side effects of chemotherapy?
Yes. Yes.
Right. So what are the best type of food that we usually recommend for breast cancer is definitely whole food. So a lot of people, there are many different kind of diet plan that you can follow, but generally for people who are going through a chemotherapy, we want them to make sure, their red blood cell and the immunity strong enough. We don't want them to lose muscle, to lose too much weight, because their body is fighting a war with the cancer. So we want them to eat whole food. We want them to have a balanced diet, enough protein, enough fiber, probiotics, all these that contribute to to boost their immunity. So it's something that they should be eating. Antioxidant food, fiber, these are very, very important. And also cruciferous vegetable that help them with liver, because chemo therapy is basically, a poison to your body. So you put in some poison to kill cancer cells, and it's medicine, right? And that will have an impact on your liver as well. So how do you help your liver to function properly, and how do you help your liver to detox more effectively, to metabolize all these medication? So this is something that we will advise them, like cruciferous vegetable is really good in that. But of course, many things, we need multiple nutrients to help our body to function effectively. So it's a balanced diet. But depending on maybe the indicators of their blood test, for example, their liver. So if their liver, is compromising, so what are the supplements like milk thistle, dandelion, protein, good fat, avocado? These are very important to help them to boost their liver function, and to help them help their liver up a bit, with this war. Yeah.
Okay. Good. Thank you for answering that question. The same person.
Can I just
Yes, of course.
Can I just also say something? Shirley, I mean, hit the nail on the head in terms of the advice and stuff like that. But can I just say something in terms of people who have cancer? I mean, to the caregivers of people who have cancer. Let the person eat whatever they want to eat, whatever makes them feel good. Honestly, I've had people who have come to us with cancer, and the family, the person has been eating meat or eats Indian food all her life, and she eats meat and vegetables, etc., etc. As soon as she got cancer, her family put her on an all vegetarian diet, and it was all smoothies. So all the various smoothies that you can do. So it was completely the opposite to what she's eaten all her life, what she's comforted by. They put her on all these Western style smoothies of fruit and vegetables, etc., etc. And she hated it. And because she hated it, because it was so alien to her, she didn't eat anything. And she lost weight, and so I think it needs, as Shirley says, it needs to be balanced.
Yeah.
You need to know what is going to excite your appetite, and allow the person, to have these things which help them in terms of increasing their appetite and nutrition. So yeah, that's just what I wanted to say.
No, it's all good. I think that's a great sample to kind of look into, because I think everyone has a unique body on how it functions, and this is the same thing what the previous two nonprofits that we had on the show said, roughly the same thing in terms of ensuring that they consume what they consume best. But aside to that, Dr. Sound, there's another follow-up question to that, because I'm touching on the cancer treatment part now. Again, from the same person, Esther Lai is asking, and I can pose this question to both of you, starting with you, Dr. Sound. Her question is, would you be okay if patients were to take vitamin C or vitamin D while on cancer treatments? And is there any specific, any kind of food that will interfere with?
Okay. When you take supplements when it comes to cancer treatment, etc., I think it's whatever supplements they are. I mean, I think, vitamin C, vitamin D are fairly common supplements, and it depends on the doses that you take with these supplements. But I think the most important thing is that you talk to your doctor about it as well, that you inform your doctor that you are taking these supplements, because everyone goes through a different type of cancer treatment. So no two cancer treatments might be completely similar. And if you talk to friends and you talk to someone else and they said that, I took this supplement during my cancer treatment and, the doctor said it was okay, et cetera, you might think that, oh, okay, I can do the same as well. But you might be on a completely different treatment regime, which, yes, that supplement that you're taking might impact the treatment that is being given. So whatever you take, it is very, very important to talk to your doctor about it. And if not your doctor, at least your pharmacist about it as well. I know a lot of patients are scared to talk to their doctors about this, that they're afraid that the doctors are going to yell at them or, shout at them and say, why are you doing things like this? You should only take my treatment, et cetera, et cetera. And to be fair to patients, yes, doctors were like that for a very, very long time. But in the last decade, doctors have learned that patients' voices are very, very important as well. In terms of compliance, in terms of people continuing their treatment, etc., they have realized that they have to listen to their patient's voice, and their patient's voice are equally important in the conversation and in the treatment. So yeah, they won't yell at you, and you should talk to them.
Okay, and Shirley, would you like to answer your question?
The same question?
Yes, because
whether they can take vitamin D, vitamin C, and etc.
I just want to see if there's any difference or you're on the same page. It's interesting to see different focuses.
Yes, I agree with Dr. Sound that I think whatever supplements and any medication that you take, you should you should talk to your oncologist or the doctors who are treating who are giving the treatment, because just to make sure there is no contraindication to the treatment that they that you are doing. However, I do agree because I know some doctors, they may not like to include supplements because they may not, because there are a lot of unknown as well, because a lot of studies are not done with these supplements and that medication, so that they want to exclude or try to avoid any things that might happen or any unpredictable outcome. But I think it's very, very important, just like Dr. Sean has mentioned, we have to listen to the patient's voices, because it's essentially their body. If they feel very fatigued, if they feel, they just need something to help them to boost their immunity, they feel like they don't feel well and they want to resort to certain food or supplements that make them feel better, I think that will also help them a lot in their mental well-being and also their body to be able to withstand that whole journey. So I think whatever that they feel that can help them better, they should discuss with the doctor, and maybe, so it's like that there should be a collaboration between a doctor, supplements, whether they can come to a common ground, as in to allow both, like the more holistic and integrated kind of treatment to go together. Yeah.
Okay. This slipped my mind, but I was going to say, I like your tagline behind your logo there. Reverse age, reset health. This is out of the topic, but it just helped me thinking all the time. But go back to Dr. Sound about NCSM, about just about other things that we could learn on your journey with them and the things that you have gone through. In your past experience being there, what is the most significant challenges that you could share with us and that became a success for NSSM and its mission to reduce the burden of cancer in Malaysia?
Oh, wow. You see, I'm a dinosaur. So I've been at National Cancer Society now for 23 years.
Oh, wow.
So that's why I say a dinosaur. So when you ask me a question like that, it's like, oh, okay, where do I start? But I think what I'd like to say is that what I'm especially proud about or happy about is changing the landscape for cancer. This is more of a personal story. I never thought that I would be in the cancer field. I never thought that I'd be running a non-profit cancer organization in my life. That wasn't my path that I had thought for myself. But my mother is a cancer survivor, and she got cancer for the first time when I was 5 years old. And subsequently, she got cancer again when I was in medical school, and then when I was working in Hospital Kuala Lumpur. So Mum has had cancer now 6 times, and they've all been different cancers. And I think that really impacted me more, not so much as a doctor, but it impacted me more as a caregiver, seeing that the journey she went through. And to be honest, my mother was, or is, she's still alive and she's 94 years old. She is a doctor herself. And even though she was a doctor herself, the journey she went through was fraught with difficulties and challenges for her. And she was surrounded by all her colleagues and friends, et cetera, who were doctors themselves and who were looking after her. And even with that, she had such a rough journey with a couple of her cancers, especially in terms that she had cancer of the colon and cancer of the stomach. And there were a few mishaps on the way and stuff like that. But what I realized as a caregiver was that we all looked at her physical, we looked at the cancer. We all looked at the physicality of the cancer and what we could do in terms of treatment. You do the surgery, do you do the chemotherapy, do you do the radiotherapy, et cetera, and we never looked at her as a person. And me as a daughter, I think that was my biggest regret. 30 years ago when I was a young doctor, that I never really saw that the psychosocial aspect of cancer was equally important to the treatment of cancer than the drugs or the treatment, the clinical treatment that you provide for the person. And that made me start when I joined the National Cancer Society of Malaysia. I joined them as a doctor to do the screening and the early detection, etc. But that made me actually start the Resource and Wellbeing Center and the psychosocial support aspects of cancer. And those days, whenever we had a person come with cancer, my mother was the go-to person. I would ring her up and say, you have to talk to this person. You have to explain that, you have to get your treatment done, et cetera, because you're a survivor. It's the doctor can talk for hours and hours and hours, and the person can just walk out and not want to do treatment still. But when you have a fellow survivor come to you and explain that, yes, it's hard, it's challenging. Yes, you might lose all your hair. Yes, there's pain, there's suffering, but you have life at the end of it. It is a journey, and there's obstacles, but you see you can get through it. They change their mind. So yes, for the first few years when we did this, my mother was very, very busy talking to people on the phone. But what came out of it was a group called Pink Unity. So Pink Unity is a group of women survivors of all cancers. And they started in 2008 under the platform of the National Cancer Society of Malaysia. And they provide peer support. They provide a whole host of services for women with cancer. And I think, when you say what are the successes that I thrive on, that makes me continue this and still be part of National Cancer Society, is knowing that we provided the platform for voices to be heard. We provided that pathway for people to take to realize that they are a person, irrespective of whether they have cancer. They're still a mother, they're still a child, they're still part of a community, and you're not defined by your cancer. And you can beat your cancer, just not physically, but you can beat your cancer mentally and socially, and you can help others do the same. So when you talk about successes over 20 years, to me is really letting cancer be a word that we can say out loud.
Yeah.
And talk about it without fearing death at the end of the sentence. So I think that would be what I would say in terms of successes.
No, that's that's beautifully shared. I thank you for taking it all out on sharing those moments. Especially your personal story of your mom. I'm so happy to hear your mom is still going strong at 95.
95 next year. Yeah.
95. Okay, she's almost like Ton's age. So that's pretty cool. That's good stuff. I pray for her that she will have better health as always and so forth. I actually don't have anyone who in my family that may have come across cancer, but I do have a family in one of my mother's side. They always have cysts, and they're usually benign cysts. So this is my question to the both of you. Perhaps I'll start with you, Dr. Sound. How common is it for cysts to evolve into being cancerous? And is there a specific focus for with cysts that could be, because every time I have a benign cyst right here. It's right on my shoulder here, right? It's benign. So is there a possibility it will not become benign over the years to come? Because I've had this for over 4 years now, and I didn't even do anything to go for an operation, because they just told me, "Oh, don't worry about it. You'll be fine." But out of concern, because we're in this topic, right? So I'm just hoping to ask directly from the Queen herself.
Okay, cysts are incredibly common for men and women as well. For women, cysts are commonly what we have are breast cysts or ovarian cysts, etc. And a benign cyst has an incredibly low percentage of changing into cancer. So generally what we say is that a benign cyst will not change into cancer. However, at the same site of where you have that cyst,
yes,
cancer can also grow, if you know what I mean. So cancer can grow in any cells. But with a benign cyst, it's not that the old cells which are there change to become cancer. It is just new self-growth at the same place as where that benign cyst might be.
Okay.
So yes, in terms of benign cyst changing into cancer, it is incredibly rare. But what you need to realize, though, is that just because you have benign cysts does not mean that, if another cyst come up, you're going to sit there and say, oh, it's benign because I have another cyst which is benign. As you grow older, you have to recognize the fact that any new lump that you get, whether it be cysts or whether it be a solid lump, we need to check it out to make sure that it is not cancer.
Okay. Makes sense. Okay, thank you for answering me that question, because I've had that on the back of my mind for a long time. Again, I'm still illiterate with these kind of topics, so I'm learning plenty of stuff from the both of you. Now, speaking about Cancer Awareness Month, I just wanted to ask back to Shirley again, because Shirley, you shared, you told me and the team beforehand you're doing something special with your business on allowing people to, I guess you're contributing for your profits to this cause. Would you want to talk a bit about that?
Yeah, so this month, because being a breast cancer awareness month, so what my company is doing to, just to do the least that we could do to help breast cancer women and also breast cancer patients, and also any society that raised awareness and do education do education and raise awareness on this topic. So hopefully we can do the least that we could do for people who purchase, anything from our platform, our services. We will donate a small percentage of that and donate it to your platform. Yeah. So this is how, the little things that we can do to help to raise the awareness of breast cancer and to help the breast cancer patient, in terms of donation. Yeah.
Thank you so much for that gesture. We really appreciate you helping us out with raising the donation. For those who don't know what's going on, this Cancer Awareness Month is we're having a pool of fund called the Cancer Awareness Month Impact Fund, where all the funds collected will be divided to give equally to all the 4 big non-profits that's related to cancer, being with Pink Ribbon, Breast Cancer, Wellness Foundation, with Makna, and also with NCSM. So there is a donation button if you're watching from the Emers TV button platform right now. So if you can just go down there and just click that button, that would be very nice of you. And if even better, you can go to bewells.my. Did I say the address right? Bewell.my.
To bewell.com.
To bewell.com. Sorry. So my bad. So go to bewell.com, purchase whatever you see that will benefit you, and a percentage of that proceeds will go to the our fund here at the Cancer Awareness Month Impact Fund. We're already 1 hour into the conversation, and I thought of asking one last question before we go. And again, this is to NCSM. I wanted to ask about some insights. We're dwelling the future now. Everyone's talking about AI. Everyone's talking about, at one point blockchain and whatnot. But wherever there's relevancy in innovating of the work that would simplify and maximize productivity and results, of course, we'll always have that tendency to explore. So I'd like to understand if you could also share a bit of any insights that, whether it's still in the works, whether you are looking into the role of technology and innovation when it comes to cancer prevention, early detection, or any kind of support services. Is this something that is in the pipeline?
Yeah, there is actually. So what we're trying to do basically now is that, you've talked about this whole idea of health promotion and being aware and doing your screening and your early detection, et cetera, et cetera. So what we want to do is to make it easier for people in terms of remembering when they should be doing this and access to it, et cetera. So we're coming up with a National Cancer Screening Registry. So what that means is that if you come for a screening, so if you come to one of our trucks, as I mentioned, we need volunteers to put in the data and et cetera, and to register people and stuff like that.
Yeah.
Is that once we can get you onto the registry, if you've done a screening and tests, et cetera, we will actually put you onto the platform so that you have this information in your pocket, basically. So on your phone, et cetera, you'd have the information of whatever investigations you've done. You'll have the information of when you should be going for your next tests, et cetera. You can keep your own data on your own account, so you can actually take that from different hospitals. If you go to different hospitals, et cetera, you can actually put that information into this one platform, so that you hold your own data. I think one of the things which we're very weak in terms of in Malaysia is that when it comes to health, a lot of people don't actually have the health records. They don't keep their reports. So when you go to a new doctor, you can't exactly explain what you've done before, especially if you go to a public hospital, because the public hospital keeps your health records, or they keep your investigations, etc. So if you go to another hospital or another clinic, you have no access to that. So this is really a platform for you to actually keep all these data, so that if you go to another hospital, if you go anywhere else, you can actually combine all this data into one platform. So that is something that we're working on with our partners, and we hope to have that up and running by next year.
Okay. Next is in 3 months.
Yeah, and I think, when you say it like that, it's like, okay. But empowerment. I think at the end of the day, it is people looking after themselves. Health is not something or well-being is not something that you can put in someone else's hands. You have to keep it in your hands. And whatever we can do to empower people to recognize that and take that up themselves, I think we can make a difference. We can actually change the health trajectory of a lot of people in Malaysia. So yeah.
Well, most definitely. I mean, so Shirley, any cutting edge stuff you're working on, or perhaps with the potential to joint venture or maybe collaborate with NCSM in the near future?
No, but if there is anything that
join our psychosocial support team. I think what you're doing is exactly what we're doing. So, we can widen it and expose a lot of people.
Yeah, I'll be more than happy to support. Yeah.
I mean, if you're going to work on that technology database that you just shared, Dr. Sound, there's plenty of variations that you can do with your partners, even with, say, if you have Shirley on board. There's a lot of, like, from having an affiliate focus to cross partnership, knowledge bases, or even sharing each other's resources where it matters, as long as it is a win-win, of course. I mean, I've seen this many times over. We focus on our technology. The focus of Incitement is building a tech-focused platform that brings all players together, whether you're a corporate company, you're a nonprofit, you're a user, you're a volunteer, you're an expertise. And to some extent, there's a lot of variations that you could actually expand to. And it's just a matter of how creative you can be and how much of an appetite there is for all parties involved and everyone's aligned. And the possibilities are endless, of course. I just thought of putting it out there because, just like you said, Dr. Sound, it's community driven that allows to empower more. And the only way to do so is to get to know your neighbor. We know now that Shirley knows Dr. Sound, and Dr. Sound knows the work of Shirley. And I think there's a lot of scope to be widened if there's a will to explore. And this is what we're doing. This is the whole point of our Cancer Awareness Month as well, not just to collect donation and spread the awareness, but to see if there's any links that could have been connected in the past, and now we can move forward for tomorrow to see if there's potential future to kind of work together. I just thought of saying that because that's how I like to wrap up the things, because sometimes when you're having fun, time flies when you're having fun, right? Because I've had this amazing conversation, learning the both of you, and the fact that I'm in touch with the both of you speaks volume of how we would like to take things to the next level when we could share the awareness and trying to get people out there. My whole point of doing this too is to kind of reach out to the young ones. That's why we have a very reliable partner called Youth Venture Asia, and they are the ones who are disseminating all the awareness to all the younger students, or the younger crowd from university to university nationwide, and they've been actively doing so, hoping they can catch a glimpse of what can they do more, because I was raised abroad most of my life, and I went to high school in the U.S. And already at the age of 15, I believe, we had classes that taught us how to detect. For women, they had a separate class for breast cancer, and for men, they looked at that time was testicle cancer for boys.
Testicular,
so yes, so we had that already exposed. So And then when I'm back home here, I do not know if I see those initiatives around me. And I was just going to ask this last question to you, Dr. Salma, and perhaps to you, Shirley, how active are we in decimating by educating the primary or secondary kids to be more aware of our health, other than always focusing on STEM and art and all the other relevant stuff, of course. But it is alarming when we look at data, because I'm a data person, right? So when I look at data, it's pretty alarming when again, prevention is the best cure. So it would have made more sense if we had done it starting it at a younger level. Is that something that you're working on, or is it already going to be pushed by the Ministry of Health? Or
Okay, unfortunately, you've touched on a very sensitive topic here, purely because it's something that we've been lobbying for a very, 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 very long time. But unfortunately, it's not so much our health education, it's our education department in Malaysia has deemed that these are sensitive topics because it talks about reproductive and sexual health. So when you talk about testicular cancer or cervical cancer or breast cancer, etc., these are topics which they don't like to be talked about in school, and it's something we've railed against for a very long time. And women's groups have also come out, and educationalists have also come out and said, listen, you can't run away from normal human anatomy. Yes, we are male, we are female, we're going to have differences. And, we need to recognize that and recognize that, we're going to react differently to health issues. And being aware about it at a younger age makes us more comfortable to seek help and to ask questions, simply just to even ask questions when something you feel is wrong. So honestly, this is something I think you could take up the cause, and everybody should take up the cause, because I think one of the issues as well is that a lot of parents have abdicated the responsibility to schools. A lot of parents sit there and say that, they'll talk about sex education in school. They'll talk about this, health in school, et cetera, et cetera. And parents nowadays are so busy because both parents are working. They don't have time to talk to their kids about a lot of these things, expecting that the school is going to do it. And unfortunately, our schools don't. And because of that, our health literacy in Malaysia is actually very low. We're looking at less than 4%, I think, in terms of health literacy. When talking about health, healthy lifestyles and health stuff, compared to other countries, which you're looking at, 6, 7, 8%, etc. And the States is one of those countries. So yes, that is an area we can all do a lot about, but it shouldn't be just the health sector talking about it. That's the other thing. Everybody thinks, it's the health ministry who should be talking about it only, but it's not. It's society. As a society, we should be able to be talking about these things, irrespective of religion. It's been made into a religious issue, which is wrong. It is a societal issue that we all have to face.
I think we all can relate to that in different levels. I have to agree with you, because that is one of the barriers, I would say. It was one of my questions, actually, that I would like to ask earlier, but it came at a time where this is more relevant to ask. So there is a barrier, and if you have been doing it for the past 23 years, and I guess we probably need another 2 decades, hopefully, or hopefully, inshallah, maybe less than that.
No.
Okay. I take it back. But yes, of course, this is where this conversation becomes more prominent, and that's why I like to pose these things so that people could hear and understand, so that they can just not look at their own lens. Just have to widen it just a bit to see, to kind of understand the repercussions, of this could have been prevented because of X, Y, and Z. This could have done better if we have done better with our way of decimating information. But again, the challenge still is there. It's actually the society, as you say, and it's not just education ministry talking trying to lobby it, or even you guys. So in that sense, I would like to take that up, and then perhaps maybe start a Q&A maybe down the road, and I could definitely take this up to the next section, next show, which is with the Magna, and probably ask them the same question, to see what else we can do.
I think many of the people who watch, as you said, you work with young people, is to incite young people to ask these questions.
I am not inciting hate, because the name incite means to provoke you to do something. Yes, that's what it means. So I'm inciting you to do positive stuff. So I'm so happy that you got it on the go, because I get a lot of I get a lot of people giving bad things about it to me, because they think I'm inciting an uprising or whatnot. But thank you for saying that.
But you're inciting a positive uprising.
Yes, a positive uprising that will benefit all walks of society and animals and environment and so forth. So that's the whole point. We've been around for 13 years, so we've been inciting for 13 years, and we hope to keep inciting where it matters. That's why the show is called It Matters. If it makes sense. But I love to ask more questions and keep this conversation going. But I'm given by the director that it's time to wrap up. And I would like to ask again to the both of you. Would you like to say any few words? Any few words before we conclude? Shirley.
No, I think I'm good.
So good. Dr. Sana, any words you'd like to say to the youth who are watching? There's like 50 people.
Get incited. Honestly, get incited. Get passionate about health issues, because health issues impact every aspect of your life. And don't think that it's something which happens when you're your parents' age, etc., etc. It starts now. It starts now that you have to make your difference now, and make your impact now.
I could not agree more. Well said, Dr. Sana. Thank you so much for saying those powerful words. Again, thank you both of you for being in the show. I look forward to reconnecting again outside the show, and then hopefully we can keep this conversation going. And I'm looking forward for any kind of impactful things that could come about from this conversation. And with that, I'd like to say, have a pleasant good night. Thank you for spending your Wednesday, not your weekend, with me. And hopefully I'll see you in the flesh. So Zikri signing out. Shirley, I'll see you later. And Dr. Sana, you have an amazing week ahead of you. See you, lads.
See you.